So when we say cholera, what exactly do we want to talk about? So cholera is a highly infectious and often deadly diarrheal disease, and is normally caused by bacterium Vibrio cholerae, bacterium Vibrio cholerae, and is characterized by severe diarrhea, vomiting, and dehydration. Vomiting and dehydration. And let's talk about the mechanism of this deadly disease. Let's talk about the mechanism of this deadly disease. So, cholera is a highly infectious and often deadly diarrheal disease, as I said earlier, and it has been plaguing humanity for centuries. Actually, this disease is caused by a bacterium Vibrio cholerae. So I just saw one person joining. Please give me a hi so that I'll give you a shout out over here. Thank you very much for joining, and please double tap on the screen to like this video. So I'm talking about cholera, how it occurs, the symptoms associated, and how we are going to prevent cholera. So over here, what I was talking about is how cholera actually occurs. Wow, so I've seen 5 people joining right now. Thank you for joining. Please double tap on the screen to like this video and also subscribe to this channel for more health tips. And please give me a hi in the comment section so that I can shout your name out here. Okay, so now let's talk about the mechanism of cholera. The mechanism of cholera. So, what I'm trying to say here is the journey of cholera begins when cholera bacteria, the bacteria that causes cholera is Vibrio cholera bacteria, happens to be ingested through contaminated food or water. So, when this bacterium happens to be ingested through contaminated food or water, it happens through either eating food that has been handled by someone who has cholera, or drinking water that has been contaminated, drinking water that has been contaminated from its source, or consuming raw or safe uncooked seafood. So let me go over this again. It can happen either through eating food that has been handled by someone having cholera already, or either consuming food that has been cooked, that has not been cooked, undercooked food from sea, or any undercooked seafood, and also consuming water that has been contaminated from its source. Thank you all for joining. Thank you for joining. Please let me get a hi and let me know that you are really following, and please double tap on the screen to like this video and kindly subscribe to this channel for more health related content. All right, so let's continue. Once this bacteria happen to enter the body, once this bacteria happen to enter the body, it must survive in that acidic medium. I hope we most of us know that we have our stomach has an acidic, okay, so it has to survive in that acidic medium inside our stomach. So to do this, the Vibrio cholera produces a special enzyme called urease, urease, which helps neutralize the stomach acid and allows bacteria to survive. So, with our stomach having an acidic medium, this bacteria happens to neutralize it so that it can stay inside our stomach and survive. So, once the bacteria is able to survive in the stomach, they colonize the small intestines. They happen to colonize the small intestines, making themselves at home. Here, they produce a substance called cholera toxin, which is responsible for the symptoms of cholera. And this cholera toxin binds with specific receptors on the surface of the intestinal cells called GM1 gangliosides. GN1 gangliosides. So this binding actually causes a massive release of fluids and electrolytes into the intestine, leading to severe diarrhea and vomiting. I hope you are getting it from the beginning. So this binding will cause a massive release of fluids and electrolytes into the intestine, and this is why it happens that one symptom of cholera is diarrhea because of of the the binding of the receptors to the surface of the intestinal cells. So in conclusion, the mechanism of cholera is complex. It's a complex process, and that involves the survival of the Vibrio cholerae bacteria in the stomach, colonizing the small intestines. So let's talk about, by knowing how cholera occurs, we can now take steps to prevent it. I'll talk about that very soon. So let's talk about the symptoms of cholera within 1 to 5 days after infection. So one, diarrhea. Cholera's hallmark symptom is a sudden onset of profuse watery diarrhea, often described as rice water stool, due to its pale milky appearance. So we are describing how the diarrhea stool happens to appear in reality. So with cholera, one hallmark or one symptom that you can easily identify is diarrhea. Diarrhea. The next point is vomiting. So vomiting often accompanies diarrhea. Further exa- it also accompanies diarrhea and further ex- it accompanies diarrhea and dehydration and electrolyte imbalance. Vomiting often accompanies diarrhea, exhibiting dehydration and electrolyte imbalance. The next point I have here is dehydration. One symptom of cholera is dehydration. So dehydration, rapid dehydration can occur due to massive loss through diarrhea and vomiting. So as a result of diarrhea, vomiting, the person becomes dehydrated because everything you are eating happens to get out of your body again. So you become dehydrated. That's one symptom of cholera. Excessive, so under the dehydration, we have excessive thirst, dark urine because you don't have much water in you. And if you don't have much water in you, your urine is definitely going to turn into a different color instead of the normal color. So you can actually watch. I have a video on kidney. So you can watch that. Is on my channel to understand more about the dark urine. All right. Another is decreased urine output and dry mouth as well as sunken eyes. The next symptom I have here is bloating, nausea. They are all other symptoms. Fatigue, headache, also another symptom of cholera. Now let's talk about how cholera happens to occur, causes of cholera. What causes cholera? So I hope you've understood all that I said earlier. So one cause of water. Cholera is primarily spread through consumption of contaminated food and water. Vibrio cholerae can contaminate food and water sources, especially in areas with poor sanitation and hygiene. So you have to be very careful about wherever you are, your environment especially. Make sure that wherever you are, the environment is kept tidy and not filthy, because a filthy environment can actually attract this bacteria into the water body. Next, poor sanitation, as I explained earlier, poor sanitation can also be one point. Contaminated water sources. So, cholera bacteria can thrive in stagnant or slow moving water, and this is one cause. Food handling and preparation. So, let's take note of this. Food can become contaminated with cholera bacteria through handling by infected individuals. Contaminated water or poor food storage and preparation practices. The next point I have here is person to person transmission. Person to person transmission. Cholera can also be spread through direct contact with an infected person's feces or vomit. That's why I said earlier on that if you happen to get in contact with someone infected with cholera's vomit or feces, you can also get infected with cholera. That's also one point. And I know this point is quite surprising, but yes, that's it. So, another point is poor waste management. Inadequate waste management, including disposal of human waste, can also contribute to the spread of cholera. The next point I have here is lack of access to clean water. In areas where there is access to clean water and sanitation, there is limited risk of cholera outbreak. So you have to be careful with whatever you are taking inside you. Thank you for liking this video. Thank you very much. Thank you. Thank you. So now let's talk about prevention of cholera. Thank you very much for liking this video. Please don't forget to also subscribe to this channel for more health tips like this. So now let's talk about how we are going to prevent cholera. How are we going to prevent cholera? So cholera requires a combination of good sanitation practices, safe food and water handling, and access to proper sanitation facilities. So this is what I said. Preventing cholera, you have to combine good sanitation. That's one. Safe food and water handling and access to proper sanitation. Three. So let's listen to some of the effective ways we can prevent cholera. So one, drink safe water. Drink water from a safe source as well as maintained water treatment plant or water filter that can remove bacteria. Hope you're getting. So make sure whatever you are taking inside you is purified. Two, use water purification tables, as I said right now. If you are traveling to an area where there is cholera, use water purification tables or filters to make sure you are drinking water which is safe. Avoid drinking untreated water. Avoid drinking untreated water. Okay. Now to the safe handling of food. Eat cooked food. Eat food that has been cooked thoroughly, especially seafood, to kill bacteria and viruses. Cook it thoroughly to kill bacteria and viruses. Avoid raw or uncooked seafood. Avoid eating raw or uncooked seafood because it may be contaminated with cholera bacteria. Three, avoid eating food from okay, this point has to be halted on. Good hygiene practices. Wash your hands frequently with soap under running water. So you are supposed to wash your hands frequently with soap and clean water, especially after using the toilet, before handling food, and after caring for someone with cholera. So both before handling food and even after caring for someone who has been infected with cholera. Two, use hand sanitizer. Use hand sanitizer. So using hand sanitizer is a very good way if soap and water is not available. Three, keep your environment clean. It's very important to keep your environment clean. Proper facilities. So use a toilet or latrine. Use a toilet that is properly maintained and kept clean. Avoid defecating in open areas because it can contaminate the environment and spread cholera. Properly dispose of human waste, including feces, urine, to prevent contamination of the environment. Vaccination. So get vaccinated. Consider getting vaccinated against cholera if you are traveling to an area where the cholera disease happen to be common. Follow vaccination guidelines. Follow vaccination guidelines, and also listen to healthcare professionals for advice. So the next point I have here is promote good hygiene practices. This is community based prevention. Promote good hygiene practices. Two, support cholera prevention efforts. So you can support cholera such as vaccination campaigns and water sanitation, hygiene programs. Just as I'm doing right now, I am supporting by making a video to make people aware about what cholera is about. The next point I have here is stay informed, be alert, get to know whatever is going on. So now let's move on to some treatment. So the treatment of cholera typically involves a combination of fluid replacement, antibiotics, and supportive care. So the primary goal of the treatment is to replace the lost fluids and electrolytes to prevent dehydration and shock. So that's the main reason for the treatment of cholera. So the first fluid replacement is using oral rehydration therapy, ORT, and is the most effective and widely used treatment for cholera. It involves drinking a solution of water, salt, and sugars to replace the lost fluids and electrolytes. So that's one method or way that we can help treat cholera using oral rehydration treatment. All right. Two, intravenous fluids, using intravenous fluids. So in severe cases of dehydration, intravenous fluids may be administered to rapidly replace lost fluids and electrolytes. So in severe cases, we can use intravenous fluids to replace lost fluids and electrolytes. Thank you very much for joining. Please double tap on the screen to like this video and also subscribe to this channel for more health related content like this. Okay, the next point I have here is antibiotics. So most of the times antibiotics like doxycycline is mostly commonly used for treating cholera because it is effective against the bacteria called Vibrio cholera, and it can also help reduce severity of symptoms. Ciprofloxacin is also another antibiotic that is used in areas where doxycycline is not available. Supportive care. So it is important for patients to rest and avoid strenuous activities to help their bodies recover. It's also important for patients to monitor signs of dehydration, shock, and other complications. Patients should receive adequate nutrition to help their bodies recover from the infection. Other treatments, zinc supplements can also be given to prevent or reduce the severity of the diarrhea, especially in children. And also, monitoring of dehydration. Patients should closely monitor to prevent excessive thirst, dark urine, and decreased urine output. It's essential to seek for medical attention immediately you suspect or someone else has cholera. Prompt treatment can significantly reduce the risk of complications and death. I hope you found this video very helpful. Please share this video to your friends and loved ones so that they can also get to know this message, get to know more about cholera and how it occurs. Thank you. Stay healthy. Have a nice day. Please don't forget to double tap on the screen to like this video and subscribe to this channel for more videos. Thank you.